My knee replacement makes noise. Yep, totally normal. I'm Dr. Randall Schultz, a patient, a surgeon, and your guide. I'm a board-certified orthopedic surgeon with more than 25 years of experience specializing in hip and knee replacement. Along the way, I've had the privilege of training residents and fellows and caring for thousands of patients. I've also been on the other side of the table. I've had a knee replacement myself. This is the Surgeon Unmasked. Hi, welcome back to the channel. My name is Randall Schultz. I'm an orthopedic surgeon, but I'm also a patient. I had my own knee replaced 4 years ago. Here are the top 5 things I hear people say that surprise them the most about their knee replacement. Number 1, yes, they do make noise. And I demonstrate for patients all the time. And it is normal to make noise. I tell them to worry if it doesn't. Now, there is an excessive amount that can be the sign of a problem, but the reason for that is the surface of the knee that we put on there. And by the way, we should call it a knee resurfacing, not a knee replacement. We're not removing the entire knee. We're putting a new metal surface with a piece of plastic in the middle. In most cases, we cement it to fix it to the bone. There has to be movement in that joint for you to have the ability to move the knee. If we put it in so tight, you wouldn't be able to move. You'd have stiffness. It wouldn't work very well. Particularly if you have the leg suspended, like sitting on the edge of a bed or a chair and you shake the foot a little bit, you will hear or sometimes feel a little bit of rattling in that metal and plastic. All right, let's come into an exam room. I'll show you the kind of noise a knee replacement can make, particularly when you have it suspended off of a table. I've still got the microphone right next to my knee. I will demonstrate for you. So that's a normal amount of noise in a knee replacement, nothing to be alarmed about, and it's not painful. Initially, it can be quite disturbing to people, but you eventually don't even notice it anymore. I rarely hear that other people can hear it. The patients, particularly early on in their recovery, are often caught off guard by it, and I try to prepare them and warn them for it, that it's a normal phenomenon. Another very common surprise for people with knee replacement is most people don't like to kneel on an artificial knee. I certainly don't kneel on mine, at least not very commonly, and if I do, I prefer it to be a very padded surface. When you ask people if it hurts, they say it feels weird most of the time, not that it's necessarily painful. I don't think it's probably harmful to the knee replacement, although I do worry a little bit about plumbers and carpenters and hardwood floor installers that have to kneel all the time. That number 1, it's going to be difficult for them, but 2, could it be hard, particularly if they've had their kneecap resurfaced? Now, we don't always put a surface on the kneecap, but that little plastic button that we cement to the bottom of the kneecap can be put under a lot of stress that way. I think the biggest reason people don't like to kneel is that you generally have some sensation loss near your scar that sometimes doesn't fully recover. I certainly still have a patchy area of numbness, and most people do. So you just kind of can't feel what's really going on down there, and it's kind of a strange sensation. Another thing that surprises people about knee replacements, we talk about this more with hips, is that your leg, particularly right after surgery, will feel a little bit longer. Now, unlike hip replacements, I would perhaps consider using a lift because temporarily we were more concerned about you getting full extension. We want you to be able to fully straighten that leg. So sometimes having a longer leg on the other side actually helps in your recovery. I wouldn't expect or want you to have to use it long term, but actually early on it may have a benefit for a knee replacement. But the simple geometry of it, when we take a curved line, because most people wear out one side of the joint or the other. If you wear out the inside, the knee typically becomes bow-legged. If you wear out the outside, it typically becomes knock-kneed. When we restore that angle with joint replacement and we restore the space, those two things together make the leg a little bit longer, basically where it used to be or should be. Now, there are a few situations when people's knees have become so bad that they badly damage the ligaments in their knees. And in order to make those ligaments tight, we do have to add length, space inside of that joint to get the tension back so that the knee is stable. And those patients can have sometimes enough leg length difference that they may have to use a lift more permanently, but that's pretty unusual with knee replacement. And a common complaint, and I experienced this myself, is because of that change in length and that sudden change in your gait pattern, it's really common for people to have pain in the hip, pain in the lower back in the first sort of 6 months to a year as you just adapt and adjust to an entirely new gait pattern, an entirely new posture. I've already touched on this a little bit, but the other thing that sometimes surprises people is that you are going to have numbness in your leg. We cannot make an incision without cutting through skin nerves. It's just simply not possible. And the way the nerves in the knee work is they generally run from the inside, what we call the medial side, to the outside, the lateral side. So everything towards the outside is downstream of that cut. You tend to have numbness. I know my leg felt almost kind of wooden for a long period of time, and it gradually retreats and gradually you regain that sensation. But most people are generally left with some small area of loss of sensation or feeling numbness in that area. And the final thing that tends to surprise people, and I try to encourage people, reassure them all the time, is a knee replacement particularly takes a very long time to see the finished product. People are always asking about recovery. Well, you'll be able to function and be out of pain pretty quickly, but a knee replacement takes a long time to see the finished result. For most people, it's at least a year. For many people, particularly men, I think it's sometimes over 2 years before they're finally fully recovered from the knee replacement. So be patient with it, give it time. So thank you for watching this episode. Please like, comment, subscribe. This is the Surgeon Unmasked. I plan on having some more videos coming out soon. Let me know if there's certain topics you'd like to hear about. I'm happy to discuss them. Thanks very much.